Hi, my name's Kat, and the Texas Department of State Health Services, or DSHS, asked me to talk about child blood lead levels in Texas. You already know there's no safe amount of lead in a child's blood, and you know we're supposed to test at-risk children at 12 and 24 months. Unfortunately, right now, we know we're not testing every child that should be tested. And we know we're not reporting every test result. In order to reduce blood lead levels in young children, we need to improve testing rates. I know how much you're already doing and how little time you have to do the things each child needs. We're one of the most important advocates in a child's early life, and parents look to us to help them navigate their health-related questions and more. DSHS currently only has test results for about 14% of Texas children under the age of 6. Almost 7,000 of those children have elevated lead levels, over 5 micrograms per deciliter. It's easy to understand why we care about elevated results, but you may be wondering why we have to report normal ones. Imagine if you were looking at a picture and trying to figure out what it is, but there's only a handful of pieces. That's the same problem the state of Texas faces because of incomplete reporting. Every piece of the puzzle is a kid, and every kid should count. I'm going to share a few key steps you can take to make sure each child counts. At 12 and 24 months, at-risk children should receive either a venous or capillary test. You can visit the DSHS website to find out which children are at risk and how to get an uncontaminated sample. We know during these early visits, kids are getting a lot of sticks, and sometimes parents don't want their kid to get another one. But because lead poisoning is such a subtle and irreversible condition, you need to follow up with parents to help them understand how critical testing is. Every time a parent follows through because of you, we're adding another piece to the puzzle. Your clinic sends the samples to a reference or state lab for testing. But you might not know your clinic is also responsible for reporting all tests, both elevated and non-elevated, to the Texas Lead Registry. You must send results for every one. That's the law. The labs report, but the law says you and your clinic are responsible too. It's for safety and backup. You can be an ally to the parents and the kids both by making sure you know whose job it is in your clinic to report to the Texas Lead Registry. Every result must be reported, even the ones from the state lab. By encouraging and following up with parents to get the lab work done as ordered and making sure you report every result back to the state, we can improve reporting in Texas and find the kids and regions that need our help the most. Without a complete picture, we can't know how and where to act. To learn more, visit the DSHS website, share our videos with your colleagues and patients, and help us count every child, because every child counts.